Good morning, I'm Roy Robertson. Welcome to San Diego Made, San Diego Proud, where we present the organizations helping the people of America's finest city thrive. Today we welcome back Dr. Michael Moreno and Dr. Jeffrey Bonabio from Kaiser Permanente as we discuss one of America's most troubling wellness issues, the sharp rise in the number of people diagnosed with diabetes and the condition known as prediabetes, which is estimated to affect as many as 1 in 3 Americans. November is American Diabetes Month, and the doctors are here to address some of the steps we can take to help manage these conditions, and there are steps that you can take. And the good news, I guess, is these numbers have started to kind of level out a little bit, but between like 1980 and 2014, a huge spike in diabetes.
Yeah, no, you said it. I mean, a huge spike. We went from about 5.5 million to upwards of 22 million. So you're talking about a 400% increase. It's big, big numbers. And like you said, it has leveled off, which is good news, but with good news comes bad news. Right. And the bad news is what you mentioned, being the pre-diabetic population. So these are individuals who aren't technically diabetic, right, but they're not in that normal range. It's this little gray area. Here's the biggest problem. We're looking at about 85+ million Americans. 1 in 3. I mean, there's 3 of us sitting here. Yeah. The odds are 1 in 3 may be having this condition, and those are the people we know about. Okay, there are people we don't even know about.
So talk about this distinction between pre-diabetic and diabetic and how that's likely to evolve if you don't make the adjustments that you need to make.
Yeah, and so the major adjustments, it goes back to what we've talked about here over and over, and what we talk about constantly. It's this lifestyle modification. You know, this is not about putting people on medications. This is about people moving more, exercising more. And we're not talking about going to a gym for 2 hours a day, because who has that time? Getting up and moving 20, 30 minutes a day. The more you move, the better. Making some changes in your diet, a reduction of your weight by 5 to 7% can take you from a risk of prediabetes, reduce it to 50%. So small changes lead to big, big consequences.
So you lose a little bit of weight, and you're talking about a major change in your likelihood of developing this diabetes from a pre-diabetic condition.
Exactly.
And so, Dr. Bonabio, let's talk about some of the things that Kaiser Permanente has in place to help your patients. What's the protocol? What do they go through in the screening process?
That's a great question, Roy. So what we're so proud of is that we really focus on the preventative side of it. Yeah. So obviously the diet and exercise is so important, and what we do as a health system is do everything we possibly can to help you with that. So if you come in to see your cardiologist or gastroenterologist or even dermatologist and have not had your diabetes, your blood sugar checked, we'll have a little pop-up that comes up. We'll check your blood sugar for you. If you are diabetic, you hadn't had an eye exam, we'll send you over to an eye doctor to get your diabetic eye exam.
And you guys were saying that you're doing this on the day that the patient's there, and the reason makes all the sense in the world, because you don't know if the patient's going to come back. So let's get it treated on the spot.
That's exactly it. We try to make the right thing to do the easy thing to do, so that when you come in, we'll do everything we can to help you, so that you've got people like Dr. Moreno to teach you how to eat well and exercise, and then you've got the rest of the team behind him to try to make sure that we're getting all the labs and everything else that we need to keep you healthy.
That's huge for the patients to have that available to them.
Oh, it's sometimes the most important thing that I do in a dermatology visit is to help you with your diabetes, when you really think about it. Right. Your little rash, that's not going to have any impact on your life, but having a blood sugar that's out of control absolutely could.
Yeah, and I think that's a big point. What I think Kaiser does better than anybody, honestly, is there are so many people involved. And like Jeff said, where in the community is it you go to see someone for a rash and they're hounding you about a mammogram or diabetes or pap smears or colonoscopies? Right. It's all about prevention. That's what Kaiser does better than anybody in this country.
And it's an interesting thing for people to keep in mind that are watching today that are going through the open enrollment period, because this is a huge service and, again, could have tremendous repercussions ongoing throughout your life, right?
Absolutely, absolutely.
Okay, so thanks guys for coming in. The website is kp.org to find out more. If you're pre-diabetic or diabetic, you need to schedule an appointment soon. Find out exactly what's going on with you. kp.org.